Hello, my name's Dr. Meriel Raine. I'm a GP at 19 Beaumont Street Surgery in Oxford. I'm going to talk about the differences between the two types of contraceptive devices that I fit. These two devices are the copper device, and the one that I use usually is a T-safe, and the Meriel Raine IUS device. These two devices are equally effective at contraception, and their failure rate is about less than 1 per 100 women over 5 years, which makes them both extremely reliable devices. First, I'm going to talk about the copper device. This is a plastic device with copper bands on the arms of the T-shape and a copper wire wound round the stem. This is effective at contraception because the copper is toxic to sperm, so it prevents the sperm reaching the egg, and so the sperm is unable to fertilise the egg. This is why, in some circumstances, a copper coil can be used as emergency contraception as well. The copper coil has an effect on your vaginal bleeding. During the first 3, perhaps 6 months after it's fitted, you may get some spotting or some irregular bleeding. Your bleeding should settle down into its usual pattern. However, it is not unusual for people with a copper device in situ to find that their periods are heavier, longer, and sometimes more painful. And it's important to be aware of that, and not infrequently that does not settle down. It's worth being aware that if you've until recently been using a hormonal method of contraception, which has caused your periods to be much lighter, for example, the contraceptive pill, you might find this change in bleeding unacceptable. However, the device does not have any hormones, so you cannot have any hormonal ill effects as you may get with other methods of contraception. This is one reason that for people with migraine, particularly migraine with aura, this is one of the safest methods of contraception, though there are other acceptable devices or methods of contraception as well, including a Meriel Raine IUS. Occasionally, I use another form of copper device, and this is called a Nova T. This is very slightly less effective, but only a tiny bit, than the T-safe. And the reason I might fit this coil is that it has a much narrower introducing tube, and it can be easier to fit, and technically easier and less uncomfortable in women who have a narrow cervix, who perhaps haven't had children. The narrower coil, the Nova T, lasts for 5 years, but the T-safe lasts for 10 years, and that's the one I prefer to use. So now I want to talk about the Meriel Raine IUS device. So this is a plastic T-shaped device, very similar in size to the copper devices, and this contains levonorgestrel, which is an artificial progesterone hormone, and this is released gradually into the womb lining over a period of 5 years. So it lasts for 5 years. This is again a very effective method of contraception, and it works by thinning the lining of the womb, and the result of that is that a fertilised egg is unable to implant. An additional method that it works is an effect on cervical mucus, which makes it more difficult for the sperm to reach the egg to fertilise it. The effect of this thinning of the womb lining is the cause of one of the most useful features of the Raine device, which is that the bleeding that you have is much reduced. So in the first 3 to 6 months, it's very common to get some spotting or some irregular bleeding. But generally after a year, that will settle down and you will have very much reduced bleeding, and some women will have no bleeding at all, which is generally viewed as a big advantage, and it's another reason we use this device in people who have heavy or painful periods, but some women may find that unacceptable. Because of the fact that the device has hormones as part of it, you may get a small amount of hormonal side effects. But this device is unlike most other hormonal contraceptive devices in that nearly all hormone is released into the lining of the womb and very little escapes into the bloodstream. So unlike the implant or the pill, the effect of those hormones is not felt so in such a widespread way, so you're unlikely to get hormonal side effects such as skin changes or mood swings. This is something that you may get a small amount of in the first 3 months, but it's unusual for people to find this a persistent problem. And generally, this is another big advantage of this device, the absence of those side effects. In some women, small cysts can form on the ovaries as a result of having a Raine device in place. These are completely harmless and need no treatment. Both devices, copper and Raine, are very easily removed at any time by a doctor or nurse, and after their removal, your fertility will return back to normal